Hello and welcome to Health Professional Radio. I'm your host, Neal Howard, with this Health Supplier Segment here at Health Professional Radio. Our guest in studio today is Dr. Mark Darrah, President and CEO of Athena GTX. It's a company in Johnston, Iowa, here in the United States, and it's a certified DoD small business, meaning Department of Defense. The primary responsibility that Mark has is to maintain profitability, grow the company, and to also coordinate technical activities and business development initiatives between various suppliers and in-house in support of ongoing development programs. Now, Athena GTX is a company that has been working with the military for quite some time now, and Dr. Darrah is here today to talk with us about Athena GTX and give us some more information and let us know how Athena GTX is, shooting the healthcare industry in new directions. How are you doing today, Dr. Darrah?
I'm doing great. How are you?
I'm doing well. Thank you so much for joining us today. Now, originally founded working with U.S. Special Forces, I do understand. Athena GTX is involved in designing patient-centric monitors and other software components in support of, telemedicine or remote medicine. Could you tell us exactly what it is that Athena GTX is involved in?
Sure. We have very interesting technology in a lot of the work with the Special Forces community. As you can well imagine, they are more remote or into more austere environments. And very often injuries or casualties, as they call them, need to have care before they can be returned to a hospital. So part of that is that you have a local medic or a corpsman taking care of a patient, and you have a remote subject matter expert that needs to be communicated with. And we use a telemedicine bridge or link, i.e. a radio or some type of a signal that gets back to them on vital signs and the status of the casualty.
Now, we're talking even in an actual combat situation, your technology is being used, or are we talking about things that happen when there are no firefights going on, or is it a combination of the two? Is it any type of medical assistance that requires remote access by a physician?
Well, we can break that down a little bit. Very often in the casualty, there is no physician present. It's a care provider, much like an EMT, that is rendering care to save a life before they're transported. So in the military, they use a thing very much like civilian medicine with life flight called casualty evacuation or CASEVAC. So our technology is working with the casualty before they are in what's called definitive care or before they see the physician. What we're doing is making that bridge between a remote physician that can consult with that casualty using a telemedicine link.
Okay, so I understand that you've been working with the military, a huge organization to be sure. What about when it comes to the civilian side? Telemedicine, there's been a talk of telemedicine, teleconferencing, as it were, with different hospitals and different medical learning institutions. Where does your company fit in when it comes to bridging this gap between what the military is enjoying and the civilian world?
Sure, excellent question. Well, in the civilian world, where we are primarily focused is not inside the hospital itself, but again in places like remote agencies or remote nursing homes that may not have a 24/7 physician present. We still want to provide that care for that resident in the nursing home or in the retirement village, that they can get medical help to help them with their diagnosis and treatment of that patient without requiring that patient to travel long distances to see a physician.
When it comes to the civilian side, I mean, many of us are dealing with Medicare, Medicaid, and hopefully some type of insurance before we get dinged on our taxes for not having it. What about the cost of such a wonderful advancement when it comes to medicine?
Well, there's a couple things to look at here. First of all, the technology. And what we're trying to do here is provide cost-effective technology to be used, in the remote instance, and whether it be military or civilian. The reimbursement cost of this, actually, it's some interesting data. When you look at this, telemedicine in the commercial world is all about whether the physician will be paid. We know that earlier data will help improve outcome of patients. That's very clear in the literature. we also can decrease the cost of care. That's going to be a key to implementation. So the physician will get paid, but they won't be paid the same as if the patient comes to them.
Mm-hmm.
Will they actually embrace it? That's the real limitation in telemedicine now. Medicaid, Medicare, they're all coming on scene, but private insurers are going to be a little bit different.
Now, you're talking about maybe Blue Cross Blue Shield as opposed to Medicare, Medicaid?
Oh, we can't call names now, can we?
No.
But yes, private insurance.
Let's not do that.
And, think about it this way. If our goal is to prevent the patient from going back to the hospital, here's what I think is really key. If we can increase the observation of the physician with that patient before they're transported to the hospital, we can potentially reduce the readmission of that patient. Now, the hospital may not like that because they want to fill beds. But if you do that, the insurance provider is going to love it. And some of the studies that we've done, the effects can be absolutely into the millions of dollars if we can reduce the readmissions by something as simple as 10, 20, or 30%.
Well, what type of resistance has Athena GTX experienced as they try to break into the civilian market when they've had such a good success in the military world?
Well, it's what I call a demographic issue. In the military special forces and the military in general, you're dealing with the hierarchy of rank. And if the high man on the totem pole says do it, it gets done. In the civilian world, it's a little different because usually the high end of that spectrum is the hospital administrator or a physician that sees patient readmissions as a way to make money. So number one, clearly, is not the technology, but it's a simple phrase. How are we going to get paid doing this? If it's not reimbursable, they don't want it.
Now, as we wrap up this segment, it sounds like Athena GTX has a world of experience dealing with complicated contracts and rules and regulations and basically a culture that not necessarily has a vested interest in filling hospital beds, as it were, but still a culture where injuries are going to occur constantly. There's going to be no shortage of the use for your services. In view of the fact of the sweeping changes in healthcare here in the United States that the entire world is watching and still waiting to see how things are going to shake out, is Athena GTX prepared to deal with different issues state by state as those issues come up? According to the Affordable Care Act?
Well, I think that no one is. We really don't understand
Good
it
answer.
Yet,
Good answer.
I think that what it comes down to is we have to walk before we run. I think the word telemedicine is now all the rage. And I think it started with something simple like psychiatry with video conferencing only. But I think what's coming is things like chronic obstructive pulmonary disease, COPD, and congestive heart failure, CHF. Those are the frequent flyers. And if we can prove through evidence that we're reducing the cost of care, I think everybody will jump on board. Once they jump on board, technically, the insurance providers will start to come on board. So we're taking it one step at a time. Proverbial walk before we run.
And where can our listeners get more information about Athena GTX?
Website, certainly, www.athenagtx.com. And we're also on Facebook. Like us and see what's going on. We post almost every day what's new and exciting.
Absolutely. You've been listening to Health Professional Radio, to our Health Supplier segment. It's been a pleasure talking in studio today with Dr. Mark Darrah, President and CEO of Athena GTX, originally founded working with U.S. Special Forces. Athena GTX designs patient-centric monitors and an intelligent software to strengthen patient assessment despite geographical location. Basically, they strengthen life-saving relationships by increasing physician reach and patient access to quality health care in rural areas, skilled nursing facilities, EMS, military point of injury, and also in home health here in the United States and on a global scale. It's been great talking with you today, Dr. Darrah.
I've enjoyed it. Anytime.
Thank you so much. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can also subscribe to our podcast on iTunes.